Hi there. When was the last time someone talked to you about your pelvis without talking about your uterus, ovaries, genital organs, bladder, sex, pregnancy, or your period? Well, probably not very often, but your pelvis is a lot more than a container for your reproductive organs, right? So, welcome. This is Dr. Andrea McSwain. Your pelvis is more than your reproductive organs. I want you to understand lymphatics, pelvic flow, and body intelligence. This is the Feel Better, Feel Great podcast, and I am so excited that you're here. Now, if you're thinking, oh, this is for chicks, okay, true, but also for guys. So, you have a pelvis too, and men have a very significant problems as they age with prostate, with leg swelling, varicose veins, muscle atrophy in their lower extremity, circulation disorders, peripheral vascular disease. So if you're like, oh, wait, I don't want all those things, then maybe you want to listen to this. So, again, your pelvis is more than your container for your reproductive organs and your bladder. All right, let's go into that idea, right? Like, such a large percent of people have bladder and bowel incontinence. That is the number one admission to nursing homes. I have said that more times, and I'll say it 1,000 more times. But anyway, I want you to listen to this. So pelvis is a structural foundation. It carries a lot of force. It is your primary weight-bearing girdle. Now that's a doctor term, right? Primary weight-bearing girdle, but it is the primary weight girdle for your whole body, right? So it's important when you stand, sit, walk, bend, move. It has tons of connections. It contains muscles, right? You've got your huge structural muscles there, your glutes, your quads, fascia. It's got this pelvic floor. It's got nerves that go through it, blood vessels, lymph, huge in the groin, huge in the pelvis. Of course, there's organs. I've listed many of those. And then you get into spaces that need to be open and not compressed. And when that happens and you can understand it, then you can help heal it. And that is a game changer. So what I want you to think about today is what happens when that environment is not moving well. Okay, so I said, if you're a male or if you're a female, this is applicable, right? But also, if you're struggling with anything like a diagnosis of like pelvic venous congestion, or again, prostate hypertrophy, if you have leg swelling that just does not get better. So again, I am a doctor. I treat patients in the clinic. I am not becoming your doctor. This is education only. But I have a feeling today I'm going to be offering some things to you that most doctors never give you any insights into. Okay. Also, one of my beloved patient populations that I work with is patients who struggle with Lyme/vector-borne infections. So if this is super important for you as well. Okay. So when you have tissue compression in the area, what is going on? Well, think about it. If you're thinking, this isn't me, okay, have you been sitting for hours? Okay, what happens after car rides, falls, bumps, surgery, inflammation, infection, pregnancy? Okay, years of altered movement. Maybe you have a knee pain, hip pain. You might be getting ready for hip surgery. You might have had hip surgery. Whoa. When we spend a lot of time asking in medicine is what organ is causing the symptom, and I want to tell you that there are some overarching systems in the body, right? And there are more than just organ systems. There's also flow systems, circulation, nervous system, blood vessel circulation was what I meant to say, lymphatic circulation, right? So these are kind of overarching systems because they're flow systems. And then you have organ systems. So that's like your guts and your liver and your heart, your reproductive organs that are inside your pelvis. So I wanted to ask you, and I want to teach you to ask another question that's going on, is what is happening in the environment around that organ? Again, think about your flow systems, okay? I oftentimes think about the car analogy, right? So let's just say like, this would be thinking about like the gas, the oil, right? It wouldn't be thinking about the car seat or the transmission, right? It would be thinking about how things are flowing throughout the system. And again, we oftentimes, if we have ever thought about the pelvis, we think of a picture, maybe an anatomy book. One time, it was total fluke. One of my colleagues was in New York walking on the street with her husband, and a night show, talk person was had the mic and asked for some reason about the gynecologic anatomy of the pelvis. And he asked the man, the husband, and he could not identify the organs. And these are major reproductive organs, right? The uterus, the ovaries, that was about it. I think maybe the bladder. And it was ironic because then the wife was asked by the interviewer for this late night show, like, well, what do you do? And she's like, I'm a gynecologist. And it just erupted because it was so funny that she had all this wealth of knowledge and he had like, couldn't even identify like major organ structures in the female pelvis. Okay, so the idea is if you're like ever even looked at an anatomy book with this, right? You may or may not have. But it's a far cry to understanding what is actually happening. And if you imagine it, right, you basically have like the bladder, women have all people, right, bladder, rectum, right, that's in the front and the back, respectively. And then in the center, the women have a tube for the vagina, uterus, and that branches out, and there's some ovaries. So there you have it. But that's not the structural elements we're talking about, okay? And also, your pelvis is very dynamic. It moves, it shifts, it's all over the place. Can get pulled apart, right? You've got all these bones to support it structurally. It's got everything that needs to pump. It's got everything impacting it from shock, from walking, from sitting. Actually, there's a lot of impact on your pelvis, your tailbone. A lot of people have had tailbone injuries. And then if the muscles are contracting or the fascia is tight, then we're talking about changing of forces on neighboring tissue. Okay, so again, I know this is really heady, and I just love talking about this as an osteopath who also takes care of people with very specific conditions, right? But you have to just kind of go with it a little bit because you've got to kind of connect to this idea that just because you have a pelvis doesn't mean it's working, and you need it to work. So pay attention, please, with all due love and respect, because we've got to get that blood flowing. We've got to get the blood down into the pelvis and the legs and back up with the venous system. We have to do the same thing with the lymphatics, which is your removal system. This is particularly important if you've had any pelvis congestion or you have infections like Lyme. It can play into a lot of lymphatic congestion or Epstein-Barr mono. Oh my gosh. Living in the lymphatic system, congesting it, putting a ton more tension in the pelvis. That puts tension on the other structures in the pelvis, on the nerves and the blood flow, right? So think about everything having neighbors, right? That the body is a unit. This is a really important concept in osteopathic medicine. Or if you see a body worker, right? An osteopathic physician who does adjustments is a body worker, a chiropractor, massage therapist, acupuncturist, right? Reflexologist. There's a whole spectrum of body workers, right? So that people who help you think about some of the mechanical or fluid aspects that happen in the body being a unit. So you want to realize that you can't separate the structure from the function. And I'm going to say that again, right? The structure dictates the function. Function, therefore, follows form or structure. So, if you, so when someone comes to me with a symptom, I don't only want to know where does it hurt, but what is happening around it. And this is so important. Okay. So what is happening around it, right? That's so important. And sometimes where you hurt, it's the hornet's nest of things being locked down, but the problem is actually a little bit further away from that and got to work on it. Okay, so again, let's just spend another minute thinking about the pelvis, right? Think of it as a bowl. This is a really good way to help you understand the pelvis. Again, you have a pelvis, so you want to be listening. It is a living bowl, right? It has, the bottom contains layers of muscle and connective tissue or fascia. Fascia can hold hundreds of pounds of pressure per square inch. Structures pass through and around it. That's super important. Okay? Inside the bowl sits the organs. Around it, the bones, the muscles, the fascia, and then what flows through it again? Blood, nerves, lymphatics, right? Those are your flowing systems. Okay, and we have to then accommodate movement. So that's a really important thing also as well. And so we want to get as some ideas to really help you understand that. And that kind of, once you get that idea of a bowl, okay, it's a moving bowl, it's a contracting, expanding, twisting bowl, right? It does a lot. We get into the lymphatic system, okay, and this is a little bit about like focusing our conversation today on lymphatics because they deserve a lot of attention because of the stagnation that happens in the pelvis. Okay, I'll give you a little tip. When you need to fluid equalize, so a lot of people get drained in the day, and what they want to do is lay as flat as possible for at least 45 seconds, maybe 3 to 5 minutes, and that will help you fluid equalize. But you think, well, why would I do that? Well, gravity. Sometimes gravity is winning in the day. Sometimes you're stressed out. Sometimes you're sitting for a long time. Sometimes you have infection. Sometimes you have gynecologic problems, right? If you lay down, you get to balance out some of that fluid and help distribute it. Now you think, well, I'm not like a, like a little shifter with the fluid, that is on a, I don't know, whatever you call it. But anyway, the idea is you're actually like a person, yes, but you still have to fluid equalize because you're getting a lot of pressure from gravity. So that is really helpful. And this system is getting more and more attention, which I'm so excited about, but still getting very little attention for how important it is. Okay, some people realize that we have little lymph nodes, and those are like little immune center garbage cans, right? And they get swollen when people are sick, particularly if you've had mono or Epstein-Barr virus, they can stay swollen. If you have a lot of sinus congestion, you might see it here. Some people feel groin bumps on the side of their groin. Those are lymph nodes, okay? And they're swollen, and it's not nothing. So we are told in medicine that those are like innocuous. Those are just nothing to be concerned about, but that is not true. That shows your immune system is fighting harder than it should to be defending itself for whatever is in that area. Okay, so you can see it in your neck. You can also, and you can feel it in your neck, and you can also feel it in your groin creases. And that means we're talking about pelvic congestion of your lymph flow and your trash cans and your removal centers, okay? And you can palpate that. And that's about fluid balance. It's about immune function throughout the body. And it's got a very difficult way to pump out. It requires your muscle activity, breathing, and then changes in pressure in the body. So this is how movement becomes relevant to this conversation, and breathing, right? And getting that pump, that inherent pump. Okay, so your physical environment is very relevant to what's going on. Okay, so let's get back to the pelvis. Okay, we talk about pelvic stagnation. And again, can this happen to men? Yes. Can this happen to women? Yes. Can this happen to people who have leg swelling? Yes. Peripheral vascular disease, Epstein-Barr virus, mono, which is mono, Lyme, people who are more sedentary, people who have muscles that are starting to decline in their ability to pump. Okay, so that's the word stagnation. And it's not that every pelvic symptom is caused by stagnant lymph, but definitely it's a go-to. Figure it out, okay? Because healthy tissue requires movement and exchange and a solid pump. Okay, blood needs to reach tissues, waste products need to leave, and lymphatic pathways are necessary with movement. So, okay, everything needs movement. All right, so we're just going to say that. Then I'm going to get into just another little component of infection, inflammation, and the pelvic environment. So again, just taking this broad sweeping idea of pelvic floor health, right? Lymphatics with that, structure with that. So we can really get some good movement. And infection and inflammation, pelvic inflammatory disease, again, Lyme, peripheral vascular disease, all these things, chronic infection, chronic disease, sedentary, mold exposure, all of these affect the pelvic environment because they create that, they can contribute to that stagnation. Okay, so remember, swelling isn't random. If you have those nodes in the groin creases, it matters. Your body's responding, but it can also be getting overwhelmed. And when that happens, you should really think about considering how much that's going to cause backflow into the legs. And that can cause a lot of pain. For those of you living with a lot of pain in your legs, you might consider that situation, especially because if you have pain in your legs, you're going to be walking less. And that really matters too, because if you're at a desk, in a car, on an airplane, for sure, on a couch, you're sitting for a long time, your body's not pumping or moving, then that's going to cause a lot of mechanical difficulties. The hips will remain flexed, the pelvis will remain static, right? Muscles aren't going through that contracture, and that can really contribute to becoming stiff and stagnant. So we want to do a quick reset to wake up the pelvis, right? This isn't intended to treat a pelvic disorder. It's more of a body awareness, a body intelligence exercise, right? So stand up safely and notice your feet on the floor, particularly where are the parts of your feet. So you have a bridge in your foot, you have the front of the heel. Think about those areas. Lift up the toes. Feel how that. And notice where your weight is. Are you more on the right or the left? Are you mostly through your heels? Shifting your feet. Don't force anything, but let a gentle response happen in your pelvis. And then take a comfortable breath, kind of ebb and flow, kind of feel an ebb and flow happen in your body, kind of a give and release, right? And that kind of sensation, now start to feel that going into your pelvis and starting going in through the rest of your body and start to feel that movement happening. That is supporting the flow, lymphatics, but many other things. We're just going to focus on lymphatics, starting to feel how that gets into the pelvic floor and starts supporting the movement of that. All right, so there's a lot more to it, but I just want you to think about how the pelvic lymphatics are actually an example of something bigger, because they are the primary weight-bearing girdle of the body. They are really a lot about the dynamic element of movement and integrating movement and throughout your day, so you can really get that pump going. The bigger lesson is always the pump. So next time your body gives you that small little message, a little stiff, little pressure, little tension, or your body gives you a big message, leg pain, swelling, groin nodes are present, okay? Make sure that you're not assuming something is terrible right away, but don't automatically silence it either. Start getting curious about what's happening in your body. What changed? What is this connected to? How does it feel when I move? How does it feel when I rest? And of course, you need to appreciate if there's something that needs medical evaluation. Okay? Learning your body's language isn't about necessarily giving yourself a diagnosis, right? It's actually connecting to your inner sense of having a PhD in you, right? That's body intelligence. And if you'd like more conversations about this and then how I integrate these medical concepts into our own body's intelligence, please subscribe to this channel and follow me, Dr. McSwain. Thank you so much and have a beautiful day.